Now I'd like to take a minute to introduce my colleague, Dr. Ravi Goyal. He is a biostatistician at UC San Diego, an incredible member of our team who's trying to make sense of what data we do have, and he's going to be talking about modeling impact and equity. Take it away, Ravi.
Thank you, Camille, for the great presentation on the process to design CA Notify. Since the launch of CA Notify, our team has been reviewing the data. Today, I'm going to present some preliminary findings on our understanding of the plausible impact of CA Notify and ways we can improve it, and some lessons learned for future deployments of such technology. In order to investigate the plausible impact of CA Notify, we need to understand who activated it and who are protected through behavior changes of its users. As one of the guiding principles of CA Notify was privacy, we have limited insight into who adopted. However, we know the county where they activated CA Notify for individuals using an Apple device, which represent about 90% of CA Notify activations. The map shows the percentage of activations by county population. We see a high percentage of individuals activating in counties containing and around major cities, San Francisco, Los Angeles, and San Diego. In order to gain insight into community level benefits, we conducted statistical analysis that investigates associations between county level activation and county level characteristics. From these analyses, we observed that counties with higher activation have a population with higher education and income. County level activation also correlates with the use of other protective behaviors like mask wearing, mobility change, and vaccination. With this context in mind, we developed an agent-based model to understand further into the plausible impact of CA Notify and its potential. Next slide. Agent-based models represent a class of computational models for simulating the actions and interactions of individuals. That is, it provides a platform to simulate simplified real-world scenarios. Our agent-based model can be broken down into 5 components as shown on the slide. The first component simulates all the individuals and their interactions. The next is an epidemiological model simulating disease transmission and progression. The third and fourth simulates non-pharmacological and pharmacological interventions. And the fifth component simulates CA Notify. In the next couple slides, I will provide more details in 2 of the 5 components, interactions and CA Notify. Individuals have 3 types of interactions: with their household members, with individuals in their social network, extended family, friends, and coworkers, and with other community members, for example, in stores and on transportation. We modeled the number of interactions for each type and with whom based on several data sources, including the American Community Survey. Next slide. To simulate CA Notify, we need to specify a number of aspects associated with the tool. A high-level schema showing these aspects and how they link together is shown on the slide. These aspects include knowing the number of individuals who activated and used CA Notify, understanding how do the demographics, risk, and use of other mitigation strategies differ between users and non-users, having estimates for rates associated with testing and uploading codes, and most important, knowing how behaviors increase their protective behavior, either through testing and quarantining after receiving a notification. We have some insights on the number of activations, codes uploaded, and notifications acknowledged, as Eli showed. But as mentioned by several other presenters, we have limitations on specifying many of the other aspects, including the percentage of individuals that increase their protective behavior. We base values for these unknown aspects using a combination of survey data, as Camille has shown, and other sources and assumptions. Even with these limitations, to maximize public health, it's important to investigate the plausible impact of CA Notify, some lessons learned, and ways that we can improve. Next slide, please. Before discussing our impact findings, I want to provide some context. As statistician George Box famously said, all models are wrong, but some are useful. I believe this statement is very relevant to our findings. Do we believe we have the exact number of cases averted? No, but hopefully it provides some insight on the magnitude of benefits provided by CA Notify. From the agent-based model, we estimated approximately 24,000 cases averted with a range of up to 89,000. These numbers align in approximate magnitude with results when using one of the approaches put forward by the Oxford UK team. Furthermore, these results align with the percent decrease found by an evaluation of the Netherlands digital notification system. Though we have some consistency of estimates across methods and settings, these numbers are based on strong modeling assumptions and data limitations and should be viewed in that context. Next slide. Even with these limitations, we can conclude that CA Notify prevented illness, hospitalizations, and death. However, there is room for improvement. And here, we're going to talk about some of the ways that we could improve and a lesson learned. We can increase the impact of CA Notify. And there's a couple of different options. Of course, one option is to increase the number of users. However, even without increasing the users, if everyone shared codes and changed behavior, that is, get tested after an exposure notification and quarantine, we can potentially see a 3.5 times the number of cases averted. Of course, we will not get perfect adherence, but there is a clear avenue for increasing the impact. And looping back to Camille and the design team, that is why their efforts are so critically important. Next slide. Using the agent-based model for CA Notify, we see that digital exposure notification apps can have a large impact if they're implemented early in a pandemic and equitably. Meaning, if we keep the number of activations constant, if communities with the most cases early in a pandemic activate CA Notify at higher rates, basically putting the intervention where the need is, we can have sizable impact benefits. As seen in the figure, we have the potential to reduce not only the total number of cases, but across all races and ethnicities. However, based on results not shown, the equitable deployment strategy appears to have less impact later in a pandemic. So addressing equity early is critical.